Don't take any pill that doesn't come out of a bottle with two names on it, yours and your doctor's, because if it doesn't come out of that bottle, you don't know where it comes from. And it's just too risky these days. My name is Ed Ternan, and I'm the co-founder with my wife, Mary, of Song for Charlie. And Mary and I started the organization in late 2020 after losing our youngest son to a counterfeit prescription pill made of fentanyl, what we've nicknamed Fentapills. And our goal is to prevent tragedies like our family suffered from happening to other families. And in some ways, Charlie and a lot of other kids across the country have died from these counterfeit pills made of fentanyl, not just from the powerful opioid itself, but from a lack of information. And so our goal is to tell young people and families about the new risks of the chemical drug landscape these days, and help them, give them the tools they need to have impactful conversations and keep themselves safe. Charlie was our youngest of three. In 2020, he was a college senior. And he was a great kid, and like all kids, exceptional in many ways, but also a perfectly normal kid, middle of the road in a lot of ways. So, good athlete, didn't quite make the starting lineup on the football team his senior year. Really good at math, and a real kind of connector of his friends. So a really big, strong friend group, and just a lovable guy. He was a big guy, like 6'2", 235. Just a wonderful guy. Now, Charlie was also, he had all the stresses of growing up in this day and age. And it was his senior year in college, so he's thinking about getting a job, what's going to happen with his future, and this was 2020, so it was early COVID. So Charlie struggled with a lot of the same issues that every young person does. And what happened to Charlie was that he had his fraternity house at college after living with Mary and I for a couple of months during the lockdown. And he was waiting for a job interview on the phone. And he went online with a friend, and they got what they were told was a Percocet. Now, Charlie was familiar with Percocet because he'd had a back surgery a couple years prior. He knew what it was. He knew what Percocet would do to him, and he knew how to take it as prescribed. But he went outside of normal channels to get this medicine. And what he got was not a Percocet, it was a counterfeit. And Charlie took one pill, and according to the doctors, he probably was dead in about 15 minutes from a fentanyl overdose. And that has, the shockwaves across our family and his friend group, we say that there's a big blast zone with a totally unexpected sudden death of a young person like this. And it's, Charlie is an example of this new category of victim of drug overdoses and poisonings where they are way earlier in their use or experimentation with substances, and they die because of this deception that goes on about the counterfeit nature of these pills, where they think they're getting something they are familiar with, and they get something that's made of fentanyl, which is this super potent opioid. So it happens to a lot of families across all walks of life. It doesn't discriminate. Kids from every ethnic group, every socioeconomic group, every neighborhood in the United States, this has happened. And it's happening because people don't understand the new risk of these chemicals that are in the street drug supply now. And so that's a big part of our job, is to do what little we can to just tell people. And we think we can make a big impact just by making people smarter about what's happening, I think when Charlie died, and in the 2018, 19, and 20, this was very, very new scenario. And so we hear a lot of families say, I wish I'd known, because this was not something that we knew to talk about with our kids, right? So we teach kids at a very young age to look both ways before they cross the street. We teach them how to swim. We do research and surveys at Song for Charlie, and kids are very aware that drugs like heroin and meth are extremely risky, right? But they think prescription pills are safe. And so what we hear from a lot of families of loss like ours is, we wish we knew. And again, that's a motivating factor for all of us doing this work, which is, well, let's make sure other families do know to have that conversation. And so we want to normalize that conversation around the kitchen table, right? That you have to be super careful about any pill that you might put in your mouth. And one of the things we say is, don't take any pill that doesn't come out of a bottle with 2 names on it, yours and your doctor's. Because if it doesn't come out of that bottle, you don't know where it comes from. And it's just too risky these days. After Charlie died, we looked around to find information about fentanyl and these counterfeit pills. There wasn't much out there. We were able to connect with a couple of other families that this had happened to and starting having conversations. And that's when the light bulb went on that this is not a one-off. This didn't just happen to Charlie, it's happening to others. But we did notice that there weren't any good resources with any information specifically about the counterfeit pills and their impact on younger people. And that was really the motive. Mary and I looked at ourselves and said, what small step can we take? What can we do as just your average couple to try and prevent this from happening more? And we said to ourselves, well, like, who's telling the kids? Who's warning the kids? And the answer was at that time, nobody. So we started a little website and started out we're just going to post on social media and tell other kids and families that this is happening. And that's how we got our start. Fentapill is a term that we invented, that's true. And what we wanted to do was make the distinction between, say, party pills like ecstasy or Molly that kids might take for recreational drug use, and these counterfeit prescription pills that are deliberately made to look like a real medication. And we wanted to make a distinction between those two so that we could warn the kids about this very new thing, because those were brand new, right? So we kind of combined the two terms and came up with this word Fentapil, and it's taken off a little bit, but it was very deliberately, kind of put together as let's come up with something that really makes it clear what we're talking about. Fentanyl is a very potent opioid pain reliever, and it has legitimate medical uses, and there is a pharmaceutical grade product that's used in hospitals and medical settings every day in the United States, and it's a really good pain reliever. I tell people that if you hurt yourself and you end up in an ambulance or in the emergency room, they will probably give you fentanyl and you will say thank you, because it really works. It comes on very quickly, and an advantage in a medical setting is it also wears off very quickly. Now, the illicit fentanyl that's out there, that's happening on the street because it's synthetic. You don't have to grow a plant or process plants or own land or water or personnel to grow crops. It's a synthetic, so you mix up some chemicals and produce more. So it's very easy to make, and drug traffickers know there's demand for pain pills, opioids in the United States, and so they started using this illicit version of fentanyl to make these pills. The challenge is getting the dosage right across a batch of pills or powders when you're dealing with something that is so potent that just a few grains of sand can be the difference between high and die. And inconsistent dosing is it's most of the new risk profile of this. Now, to put that in perspective, fentanyl is 50 times more potent than heroin. So imagine, say, whiskey. Everybody knows Jack Daniels, an iconic American brand. Jack Daniels whiskey is hard liquor, so because it's more potent than like beer and wine, right? So there's harder liquor, but let's stick with that one, right? Fentanyl compared to heroin would be like heroin that's 4,000 proof, 50 times more potent. Now imagine that you're having friends over and you have 10 shot glasses. You want everybody to have a safe dose of your 4,000 proof Jack Daniels. How many drops of that would you have to put in each shot glass? And the answer is there's no way to know for sure, and somebody's gonna die because it's too potent to dose accurately. And that's why young people are dying from these pills, maybe not the first time, but the second, third, or fourth time, because you just can't. The dosage is so inconsistent. I think everyone acknowledges that kids today are under a lot more stress than certainly in my day. And the advent of internet and social media and 24-hour content on streaming content everywhere There's a lot of information coming at them from all angles. So everything seems kind of amplified. And so what we're seeing is young people dying increasingly from self-medication, where they're not necessarily partying, but maybe escaping and seeking some relief from anxiety, stress, and they're trying to improve their mood. And Mary and I, when we started Song for Charlie, we knew that you just can't tell kids or families, you can't do this. You have to say, do this instead. So we have two initiatives that we push out. One is Farm Over Pharma, which is about be careful about what you put in. And the other is Skills Over Pills, which is about be mindful about what you put out. So Farm Over Pharma is like, be careful and know what's going into your body and understand that everything from food to sugar to caffeine to medicine, they all affect your body and brain, and it's all interconnected. So learn how that works and be thoughtful about what you put in. And that's never been more important than today when it comes to prescription meds. And then Skills Over Pills is about, there are organic, natural, actually better, more sustainable ways to improve your mood and relieve stress and anxiety. And it gets back to some of the things your grandma told you that you didn't want to listen to, right? Get fresh air, unplug, put the phone down, right? Play some music, exercise, prayer, meditation, sunshine. All of that stuff changes your brain chemistry the same way these drugs do. So we encourage kids to learn the neurobiology, learn how your brain works, and develop healthy coping skills, which in our day might have been maybe a nice to have, but today, in the stressful environment of today for young people, it's really a critical life skill. You have to learn how to regulate your mood naturally in the current times. Well, we've been at Song for Charlie fortunate enough to partner with some very strong organizations. And we started out putting a lot of material on social media, and we connected with some of the social media companies. So we have relationships with social media companies that give us like ad credits and advice on how to maximize their platforms. We have friends at Google and YouTube. And because of a lot of what we do is online, we develop kind of a national reputation, a national brand. And one of our taglines is real talk about fake pills. So we don't use hyperbole, we don't use alarmism, we're not judgmental or moralizing at all. It's like, look, it's more of a public health warning. Like if there were sharks in the water, you'd like to know it, right? And you might still go in the water, but at least you take precautions if you know that. So we're just telling people things have changed on the drug landscape. You need to be super careful. So as a result of our success really online, we've attracted some really cool partnerships. We're working with Major League Baseball. We're working with the NFL alumni. In addition to our corporate partners, Peachjar is a major partner for Song for Charlie. Their reach and the audience that Peachjar has is directly in line with who we need to get to with our messaging. So we're really excited about. We describe ourselves as essentially a communications company. That's my background, marketing and communications. We're a communications organization that develops and distributes educational content about the fentanyl crisis and its impact on youth and families. And we take our messaging out, we leverage technology to get our leverage out at scale. So we're like mass marketers of this messaging. And so, Peachjar and the other online platforms that we work with is perfect for us, because that's what we're trying to do, is get to as many people as we can. So at Song for Charlie, we take our messaging out both online and on the ground. And we've expanded from where we started, which was really just reaching young people where they are, which is on social media. So that's where we started, and we've expanded beyond that, but our Song for Charlie brand and that vibe remains very youth-focused, direct-to-youth focused. We've expanded our audience to include families and caregivers, and for that we developed a resource portal called The New Drug Talk, thenewdrugtalk.org, and that is full of resources about not just for parents mostly, but not just like what to say, but how to say it. And that's really important because we're way smarter now about how to have the drug talk than we were 20 years ago. And so we want to bring all those current best practices to bear and equip families to normalize this conversation and have the discussion, which we think is very preventative. We also know that it's important that people from diverse backgrounds and cultures get this message in a language they understand, delivered by faces they recognize. So we're a leader in that area as well. We have developed La Nueva Drug Talk with a team of Latinx experts that we put together. And that is not just a translation of the new drug talk, that is an entirely new, culturally appropriate portal for that demographic, which is a very diverse diaspora and with a lot of unique kind of cultural factors that go into effective messaging. And so we have started that recently, and we will expand into offerings for Native American communities, which have been disproportionately impacted by this, and the African American community, and all others. So those are ongoing projects as well. Importantly, we think that young people talking to each other is really key. And so we have recently launched a pretty robust peer-to-peer program where we have a landing page where young people can go. This is on the Song for Charlie portal, the youth portal, where they can go to access, tools, consume a little bit of educational content so they kind of are coached up so they can speak in an informed way with their friends. And then we've got posters and flyers and other swag and so forth, resources that they can use to like form a club or do some tabling or events, because we really know that changing this, turning this crisis around is going to take kind of a cultural shift, and we need to empower the next generation to lead that shift. And so we want to arm them with the resources they need to take this on themselves. And we'll get a lot of feedback from them. Believe me, we will hear from them as well as soon as they start getting active. So we're very excited about the peer-to-peer program that's coming out too. We would encourage both young people and their families to get involved in this issue. And it's important to really know what's going on. So we started out, Mary and I, with the idea that we wanted to raise awareness. And 4 years later, the level of awareness in the country about this issue is way higher than it was when we started, which is good. But awareness is knowing that something's going on. Knowledge is understanding what's going on. And only when you have that level of knowledge can you take corrective action. And so this next phase of our organization is going to be about doing just that, whether it's to youth and to families, but it's taking people to that next level. So we encourage people to dive in, learn about the issue, and they can definitely support us by following us on all our social channels. We're songforcharlie.org, Song for Charlie with a 4 on Instagram, and written out Song for Charlie on all other social channels. We want to build our following, and we put a lot of our educational content right on the socials, so they can follow us there. We are a nonprofit, completely donor supported, so anyone who wants to give to songforcharlie.org, we have a donate now button on our website, and we appreciate all the financial support we can get. We intend to be in this for the long haul and really work hard to change the way we talk about drugs in this country, so that because the drugs in the country have changed and we got to update the conversation, and we're committed to doing that. So any help that involvement or support that people can give us, we happily take it. I think Song for Charlie would like to create a community of families, kids, and people who care about kids, who are comfortable talking about mental wellness and healthy ways to cope with the very stressful environment that young people are coming up in these days. So we're more than just fentanyl awareness, we're more than just talking about drugs, we're talking about the alternatives and staying healthy and safe. And there's a lot of stigma around the conversation anytime the idea of drug use creeps into to the discussion. And so we'd like to take that stigma out, normalize the conversation about feeling bad, and ways to fix that, and engagement and community and people circling up and joining together in that conversation will be critical to kind of the cultural shift we're trying to encourage. So that's the kind of community we'd like to see. At Song for Charlie, we're really proud of the fact that we have stayed very focused on providing factual information, useful, actionable information to the people who need it most in a way that is inviting and non-judgmental. And we are proud of the fact that research shows, and some of the national numbers show, that in our demographic, the awareness efforts of our organization and other family-led organizations across the country is starting to have an impact as we see some of the tragic mortality numbers start to flatten among young people. So we can't take credit for that, and it's not time to beat our chest. There's a lot more to be done because youth deaths from drugs and fentanyl have stopped rising, but they've flattened at record high levels. So in order to get them reverse the trend and get them back down to where they were before or below, it's going to take a lot of work. But we're very proud of the fact that after 4 years, we can see that some of our work seems to be paying off, and that's very fulfilling to us. The relationship that Song for Charlie has with Peachjar is really important to us because we really share the vision that well-informed parents are going to be able to impact their children's lives in positive ways, and that's where it has to start. We share that kind of grassroots vibe, right? That's where we go, right? Real talk, direct to kids, direct to families. So the audience reach that we can get through our partnership with Peachjar to parents, but also to schools and school districts is really valuable to us. There's a big movement to kind of reimagine drug education in schools and at home in the era of fentanyl and other chemicals. And we're right out front of that conversation. And Peachjar allows us to put our messaging out to schools and families all across the country in a very targeted way. And we're seeing a lot of good results from those programs. And so we're very excited about keeping this partnership going.